In the cervical spine, most people need surgery because they have a pinched nerve or pressure on their spinal cord, and they would need to have that cleared out and then something put in to replace the disc material that's removed. The lower back, the artificial discs are for back pain. So that's really for a disc that's a broken shock absorber where people have mechanical pain, not so much for pinched nerves. That usually just needs to have a disc shaved down. But for people who have mechanical pain who would otherwise have a fusion, a lot of them could be eligible for a disc replacement instead. And that removes the disc that's been hurting and allows us to put in a disc replacement that will let that level continue to move. Once again, quicker recovery and taking away some of the stress on the next level, which does not have to work any harder than it was made for, and lasts longer. So frankly, it cuts the reoperation rate at the next level very significantly for people who have to have something done at one or two levels in their lumbar spine.